So dear colleagues, I welcome you here from beautiful Barcelona, ESMO 2019 conference. There's a lot going on in the area of metastatic renal cell carcinoma. Here in the conference, we saw data from the JAVELIN 101 trial. As you remember, JAVELIN 101 was reported beginning of this year at ASCO GU, showing a remarkable PFS benefit for the combination of axitinib and avelumab in advanced renal cell carcinoma compared to sunitinib, 13.8 months PFS benefit. So really hitting more than 1 year progression-free survival in advanced metastatic renal cell carcinoma. Here at ESMO, we saw some biomarker analysis. We also saw data on different tumor types, not just clear cell RCC. We saw data on sarcomatoid RCC, so here also this combination works. And for me personally, I always like to look at the PFS2 as one endpoint, which I think is coming more and more important. The European regulatory, like the EMA, already recommended in 2012 to use this PFS2 endpoint in clinical trials. And I think this is something what is very modern in RCC treatment, because most patients will receive second, third, or even fourth line therapy. Additionally, my dear colleague Marc-Oliver Grimm reported his TITAN RCC trial. TITAN RCC is looking at patient first and second line therapy with metastatic renal cell carcinoma. He had a very modern, interesting trial design. He started the patients on nivolumab, and the ones that progressed received ipilimumab boost. So not the standard start IP4 doses and then nivolumab, which is approved since the beginning of this year for intermediate and poor risk patients. In this indication, intermediate and poor risk metastatic RCC patients, he used the nivolumab monotherapy, and once it came to progression, he did the IPI boost. As a result, what he reported is that it's safe. However, response rates are better with a combination. So in case you really have to depend it on patient profile, but as of yet, I would recommend to use the approved standard dose of IP4 cycles, and then nivolumab maintains therapy. So I think combination still delivers the best response. We will have to await the overall survival data and PFS data out of the TITAN RCC trial, but I can and have to congratulate my dear colleague Marc-Oliver Grimm for getting this trial done, European multi-center trial. Thanks a lot for your attention.